This presentation is about the fundamental principles of pathophysiology. We are going to be talking about different concepts that are important to understand the rest of the subject. Our first learning objective is to define pathophysiology and try to fit this term into the medical field and into the sciences that study the human body. Then we are going to be talking about different key terms. We are going to talk about disease, classification, different forms of classifying disease. We are going to be talking about different causes of disease, etiology of disease. Then we are going to be talking about epidemiology, not as a science, but the epidemiological terms that we are going to be using in pathophysiology. Okay, and trying to have a big picture of pathophysiology. And then next presentation is going to be about cell injury, trying to understand how different etiologic factors affect the cell at the microscopic level, molecular level, cellular, and then these changes affect the tissues, affect the organs, and when the organs don't function well, then the entire body gets affected by this damage that in many cases starts at the molecular level. So pathophysiology is a term that is composed of three terms for sure. Pathos, that is a Greek term for suffering or disease. Physis, which means nature, and then logos, which means study. This science is relatively new, started at the end of the 19th century in Russia and China. Okay, then was introduced to the Western countries in the early 20th century. It's actually composed of two sciences, pathology and physiology. Pathology is the science that studies structural aspects of disease, like anatomy studies structure of the normal body. Pathology studies the structure of organs or tissues during disease. Sometimes the term pathology is used as a synonym for disease. We can say the patient has a disease, the patient has a pathology. So the science of pathology studies, for example, how tissues, organs look under the microscope, okay, or sometimes describing the gross structure, the gross appearance of the organs during disease. We can say when someone dies during the autopsy, okay, we can see a fatty liver, or we can see a tumor, we can see cirrhosis of the liver, just using the gross appearance, or changes in the color of the lungs in people who smoke, for example. Then at the microscopic level, we can see accumulations inside the cells, maybe of fat, maybe different pigments. So it's a structure. Pathophysiology studies the underlying functional changes or dysfunction, okay, and how these changes explain diseases. So we are going to be studying the mechanism of disease. How, for example, a heart works after a myocardial infarction. What are the changes in the cardiac output, stroke volume, contractility, end systolic volume, and diastolic volume. And of course, the causes of this myocardial infarction, different mechanisms that explain disease progression, okay, sometimes across many years, sometimes in a matter of seconds or minutes, how changes in the structure manifest as changes in the function. So pathophysiology is essential to understand and reason medicine, to elaborate a differential diagnosis, to give an explanation for the signs and symptoms, okay, to explain the rationale for asking or requesting different diagnostic tests, or giving a treatment, okay, to treat symptoms or to prevent the progression of the disease, the complications or sequela in a patient. Okay, this diagram here, okay, tries to depict that pathophysiology is like a bridge between physiology and clinical medicine. It's a link between the foundational concepts that we studied in physiology with what you are going to be doing in the future, real-world applications, clinical applications. Okay, this science is going to provide the context that you need to work in medicine for decision-making, clinical decision-making. It's going to help you anticipate, explain, understand the why. Okay, the why you are doing things that you will be doing. So let's move to study, or I'm going to briefly go over some of the topics, some of the terms that we're going to be using frequently. Some of them you are very familiar, okay, because of your previous studies. For example, a sign is an objective finding that can be observed by the clinician and can be measured. Okay, someone has certain degree of fever, 104, the rash in the arms, in the legs, tenderness. Okay, so when you touch certain part of the body, it hurts. That is tenderness. You can appreciate that. Jaundice or any discoloration of the skin, cyanosis. The symptom is subjective. The patient tells you, you can't see. Okay? Even fever is a sign that you can measure. Chills is what the patient feels when they have fever. Itchiness is what they feel when they have a rash. Pain is what they tell you they are feeling. Notice that tenderness is a sign, pain is a symptom. Okay, other symptoms are fatigue, dizziness, different subjective feelings of the patient, blurred vision. Now, a syndrome is a combination of signs and symptoms that typically or consistently occur together. You have studied a Cushing syndrome. You have studied different syndromes. You're going to be seeing different syndromes. Okay, metabolic syndrome is a great example that is at the center of the pathophysiology of many chronic conditions. Now, all these signs and symptoms or syndromes are the ones that we are going to be studying as the clinical manifestations of diseases. We are going to see that for every disease, we are going to have or represent in our minds a pattern of how they present. Someone who has the flu, they typically at the beginning may have no symptoms, then they have some maybe unspecific symptoms. They feel bad, some pain, generalized pain in the muscles, in the joints, malaise, anorexia, then they start having fever, then they start having cough, may develop sputum. So there is a pattern in which every disease presents. And what we are going to be doing in the future, or you are going to be doing, is diagnosing diseases, making a differential diagnosis. Okay, taking together the history, physical exam, results of the imaging and diagnostic tests, and identifying a disease based on putting together all that data. That is the diagnosis that clinicians make every day in their. And here we have more terms. Etiology, which simply is the study of the cause or origin of a disease. There are different causes of disease. We're going to be talking more about this in the future. And we study every sign, every symptom, every syndrome. Some of them are infectious, some of them are inflammatory, genetic, degenerative, or sometimes idiopathic when there is no identifiable cause. And there are some conditions that occur as a result of medical treatment or surgical interventions. We call that iatrogenic. Okay, again, we have here pathology. We already mentioned that at the beginning. Okay, we need to understand always what this means because these terms appear very frequently in medical practice. Okay, in pathophysiology, we are going to be studying, besides the etiology, we are going to study the pathogenesis. Probably one of the terms that we are going to use more frequently. What is the pathogenesis of certain condition? It's the underlying mechanism that leads to a disease. Okay, how they develop, the why things appear. So when we have the patient with certain manifestations, we can think and reason, okay, how this symptom or this sign developed. okay, how a disease evolves, different steps, okay, that people or different diseases manifest. More key terms. Prognosis is the predicted outcome of a disease. Okay, in most cases, and that is what we want, people get totally okay, they recover completely. Sometimes the recovery takes longer. Sometimes they recover but not completely. And sometimes people die. Now, a sequela is a long-term effect of complication of a disease. Someone has, for example, a stroke, and they develop hemiplegia or hemiparesia as a sequela. A complication is a secondary condition that arises because of the primary. Classical example is someone has the flu, which is a viral condition, okay, and they may develop a pneumonia as a result of a secondary bacterial infection. Exacerbation is when a condition worsens. Anyone with a chronic disease, COPD, heart failure, may develop or will have different exacerbations. For example, someone with COPD during the winter may get a viral infection, a cold, and they may have a very important, significant worsening of their baseline signs and symptoms, of the severity of the disease. Remission is the contrary, it's when symptoms. For example, a person with multiple sclerosis may have disease, maybe the baseline of the disease, and sometimes they get worse, then they get better, continuing the baseline, worse, better, worse, better. So those are the exacerbations and the remission periods: exacerbation, remission, exacerbation, remission. Those are terms that we are going to be using frequently for some chronic conditions. And this diagram shows the big picture of what we call pathogenesis. Remember, this is a term that we are going to be using very frequently. In many exam questions, you are going to have which of the following best explains the pathogenesis of this condition. Okay, here we have a representation of the pathogenesis that is mostly works for infectious diseases, but you are going to see that this diagram or this scheme, okay, can be applied also to non-infectious diseases. For example, a pathogen can start here. A pathogen infects the body, typically through skin or mucosa, maybe directly into the blood, okay, but that is not a very frequent form of infection. Okay, the pathogen from the skin or the mucous membranes infects the body, invades locally. We are going to have the activation of the immune response, in this case the innate immune response. Okay, the organism will replicate, will divide, will proliferate, sometimes produce some local destruction. The inflammatory response also acts locally, okay, affecting the tissue, producing the signs and symptoms of acute inflammation. Okay, from there, the organism may disseminate into the blood. Sometimes the cells of the innate immune response, for example, dendritic cells, take the pathogen to the lymph nodes, and the infection may stop there, or from the lymph nodes, the organism may disseminate into the blood. Okay, at this point, we are going to have more immune response cells and proteins involved. Typically, the adaptive immune response is the one that is recruited and acts at this point. Okay, if the pathogen is successful, will infect internal organs, secondary organs besides skin, mucous membranes, and lymph nodes, leading to tissue damage. Okay, the tissue damage sometimes leads to what we call organ failure. If several organs fail, people die. Or we may be successful, say the immune system plus medical interventions, okay, may be successful and people recover, sometimes leading to a chronic infection, chronic disease. Sometimes people die, okay, from internal organs. Okay, the person may start shedding pathogens, for example, when they cough, when they urinate, when they defecate. Okay, and these pathogens may infect another person. Okay, our task as clinicians is to try to stop this cycle at some point. Okay, the primary infection or infection of the primary organs, the infection of the secondary organs, stop the blood dissemination, stop the replication with medications. Okay, try to prevent tissue damage. Okay, try to prevent spread of the pathogen to other people. So we are going to have different points of intervention during this cycle or sequential events or pathogenesis of a disease. Notice that in the center, okay, there are some periods of the diseases that we are going to be seeing in the next slide. For example, during the primary infection, when the pathogen is in the skin or mucous membranes, or is invading, starting the invasion, and even the first replication phases, we may have no symptoms or very mild symptoms. After infection and before the symptoms start, there is a period that we call incubation period. Okay, the pathogen is latent, it's not producing any symptom. Once the innate immune response starts trying to avoid the dissemination or infection of other organs, the release of cytokines by immune system cells, tumor necrosis factor, interferons, cytokines, interleukins, are going to make us feel really bad, really miserable. We're going to have chills, lack of appetite, fatigue, malaise, joint pain, muscle pain, generalized pains. Those are unspecific symptoms. They don't help to diagnose any disease just based on the presentation. Now, once the secondary infection occurs and there is tissue damage in a specific organ or several organs, we are going to have the classical, the typical manifestations of a disease that we can identify just based on the signs and symptoms. Okay, we are going to try to understand this more clear. Here we have the definitions of these periods. Latent or incubation period, remember, no symptoms. Okay, no. This is the time from exposure to the first clinical manifestation. So it's an asymptomatic period. Okay, can be only diagnosed with blood tests or biopsies or different diagnostic tests. A prodromal period is when the first symptoms appear, but we can't identify a disease just because someone has a headache or feels tired or has malaise or anorexia or nausea. Someone has nausea, or maybe you ate something, maybe you have some stomach problem, or you ate too much too quickly, and maybe the person is pregnant, or maybe the person took a medication that is making them nauseous, or maybe they have a severe condition that is producing nausea. It's non-specific. Symptoms, signs become more specific during the illness period, manifest illness or disease. When the disease reaches the full intensity, okay, we have the symptoms and signs that are more characteristic of the specific disease and they have the greatest severity. They peak. Then they start recovering. Okay, the disease starts declining. There is a period of decline. Okay, after the illness, there is a decline. We're going to see this in a diagram that is more specific about the different periods. People start getting better, and after, okay, they recover. Okay, they are going to have a period of convalescence. That is similar to the prodromal, but of course after people get better. Okay, maybe someone had a very bad flu. They go back to work But they are not totally okay. They are not 100% well. They still say, oh my goodness, I still have this sensation of something's wrong, but I'm better. And as we said before, there are some conditions, autoimmune disorders, typical example, that have periods of exacerbations and remissions. You remember this diagram. Here we have here again the definitions of remissions and exacerbations. When people have a remission that lasts for more than 5 years, we say the person is cured. That applies more to some types of cancers and some diseases. Now, another form of classifying diseases is depending on the duration. Acute diseases, chronic diseases. Acute diseases are those that start suddenly, have a short duration, like a flu, like a cold. Okay, I'm not going to say a number of days, weeks, months, because that depends on the disease. Okay, it's not the same an acute upper respiratory tract infection than acute hepatitis. The duration is going to be in different terms. Chronic is when something is persistent, there is no cure. They may be asymptomatic. If someone has diabetes and they do their treatment very well, they are compliant with the treatment, they may be totally asymptomatic, but that doesn't mean that they don't have diabetes. Okay, if they stop doing the treatment, they're going to start having the signs and symptoms. And subacute is something that is in between. Okay, here you have this diagram explaining the stages, or representing visually the stages, okay, of incubation, prodromal, illness, decline, and convalescence. Okay, we have here in red the number of pathogens, and in blue the severity of the symptoms. Notice that they more or less correspond. Okay, the only moment when they are not corresponding totally is here, in the incubation period, that signs and symptoms are zero. Notice that the first signs and symptoms start during the prodromal period, they get worse here, they peak, okay, and the signs and symptoms, or the severity, goes almost to zero, okay. People may still have some of these virus or pathogens, toxins may be still in the blood. And talking about the different causes of disease, I'm going to give you a mnemonic so you don't forget. But diseases may be produced by genetic causes, mutation, for example, in the DNA or in the mitochondrial DNA, degenerative diseases due to aging, due to chronic inflammation, chronic disease, because of the wear and tear of the tissues, organs. Some causes of disease are congenital, malformations that occur within the uterus as a result of DNA mutations or not, maybe as a result of infections, maybe as a result of radiation, maybe as a result of simply an abnormal intrauterus environment. Inflammatory conditions or causes, okay, that is almost at the center of every disease. Immune inflammatory responses, acute, chronic, that may affect different organs in a different way. Environmental exposure to chemicals or stress, for example, PTSD, or pollution, different toxicants or poisons, chemicals, radiation, UV radiation, too much noise, different exposures, and infectious diseases, bacteria, viruses, fungi. Here we have this mnemonic that helps our memory. The mnemonic is vindicate. V is for vascular, I is for infectious, inflammatory, N is neoplastic cancer, degenerative or deficiency of nutrients is the D, intoxication, iatrogenic is the I, congenital, autoimmune or allergic, trauma, and endocrine or metabolic. So when we do our differential diagnosis in our mind, we try to remember, okay, what are the different etiologies that may produce a disease, and then we can have an idea of the different diseases that we can place here: atherosclerosis, okay, rheumatoid arthritis, lung cancer, Alzheimer's disease, scurvy, pellagra, okay, different poisons, alcohol, ethylene glycol, okay, different treatments, congenital malformations, lupus or anaphylaxis, okay, acute or chronic trauma, diabetes, Cushing's disease, okay, diabetes or metabolic syndrome. And we have to cover some epidemiology terms that are important. Epidemiology is the study of the distribution and determinants of health or health-related states in populations, not in people, not in individuals. Epidemiology is great to understand how diseases distribute in different population groups, races, ages, countries, okay, or those who are exposed to different levels of stress or different environmental exposures. Okay, epidemiology comes from different terms, from the Greek epi, which means open, demos, like in democracy, people. Logos, or logia, study of how diseases manifest in populations, in the people as a group. So the terms that we are going to be using are incidence, prevalence, risk factors, precipitating factors. Incidence is the number of new cases in a specific population in certain period. Okay, prevalence is the total number of people who have the disease. Okay, in a certain time, per year, for example. Then we have risk factors, conditions that increase the likelihood of someone getting the disease. Okay, risk factors can be modifiable or non-modifiable. Okay, the terms are self-explanatory. Modifiable factors can be changed. Non-modifiable can't be changed. So smoking, diet, physical activity. Okay, the place where you live, your income can be modified. Sometimes it's hard, but it can be. But age, genetics, these are things that can't be modified. And we shouldn't confuse risk factor with precipitating factors. Precipitating factors are those triggers that produce or provoke, accelerate the onset of a disease or symptoms. For example, someone has a myocardial infarction. What is a risk factor? There are many. Smoking, lack of physical activity, stress, atherosclerosis. But what is the precipitating factor for that myocardial infarction? Maybe an emotional upset. Maybe doing excessive exercise. Maybe taking medications or consuming drugs like cocaine. Those are precipitating factors. And then we have some other terms, okay, that we are going to be using, epidemiologic terms: public health, endemic, pandemic, epidemic. So these are things that I'm sure you're very familiar with. Morbidity, that is related or caused by a disease or disability. Mortality, related to death. Sporadic, something that occurs rarely. Sporadic cases of COVID in certain area. Okay. So, pathophysiology, and here we have the big picture, trying to summarize what we were speaking about at the beginning. It's very important to understand the why things happen and how organs work after a disease has presented. It's very important for the prevention of diseases. We are going to be studying about different diseases, their etiology, if we know it. So how we can prevent exposure of the patients to that etiology. how etiologic factors or risk factors lead to the different stages of a disease, the mechanisms that explain the different stages, the underlying mechanisms, okay, that explain how organs change structurally, and how the clinical manifestations appear. We are going to understand the why these signs and symptoms appear, and also the prognosis. What is likely to happen to patients if we treat them or we don't treat them, and if they comply or not comply with treatment. So prevention, as I said before, is important to avoid etiologic or risk factors. Screening patients allows us to identify diseases before they manifest. Biopsies, X-rays, blood tests, screenings of the blood pressure, etc. Early diagnosis when the disease, for example, is in the early stages: cervical cancer, oral cancer, prostate cancer, helps us prevent the disease progression. Treatment, depending on when we diagnose the disease, will have different benefits, will change the natural history of the disease, maybe delays. A good treatment, early treatment delays the presentation of the disease or prevents the complications, okay, or prolongs the time during that the patient is in remission, preventing exacerbations, okay, delaying or increasing the amount of years that the patients have normal health. So a treatment, early diagnosis, screenings, prevention measures, all of them can very significantly alter the prognosis, the clinical manifestations of the diseases, working in benefit for the patient and for the health system, reducing costs, reducing the number of days that people have to be off work, increasing the quality of life of the patients in general.